This was a drawing a 7-year-old girl made of her trip to the pediatrician. And that's her and her mom and her sister facing each other, active, engaged, and that's the poor pediatrician off to the side, back to the patient, missing really important verbal and nonverbal cues. And that's what I saw. I saw my colleagues, seasoned communicators and clinicians, really failing at this in a miserable and painful way. And it was not a patient-centered interaction. It was very much a computer-centered one. And it's what inspired me and our team to really think about what is the impact of this thing on that patient-doctor relationship and communication. And that's what motivated that literature search that's in your guys' packets. And what we saw was a large number of studies that showed exactly this. Back to the patient, conversations that were dictated by the template, the questions in the computer, and the way that they were laid out, rather than having a natural conversation and kind of integrating it in as you need to. Long silences of typing that were just awkward, and negative behaviors that could potentially impact the relationship. There was a group of small but inspiring studies, though. And those were most important to us because they actually asked the patient's experience. A lot of these studies were observational, so a researcher in the room recording those seconds of silence, and that's all well and good to define what the problem is, but what really matters to us is what's the patient's experience. And when we looked at those studies, there was a small but encouraging number where they thought it was better, that the EHR could be used as a tool to facilitate understanding, showing your cholesterol and graphing it, showing your x-ray, using different patient education tools on the computer. And so that's what really motivated us to figure out, how can this not be a negative? How can we flip this and make this a positive so that we're using it to engage our patients and to enhance kind of the experience of care?